Hi, it's Jon Hoeksma, editor of eHealth Insider. I'm joined today on EHI TV by Ewan Davis, legend of primary care informatics, and now founder of HANDI. Tell me a little bit about HANDI, Ewan. First of all, what does the acronym mean?
Yeah, it stands for it's rather contrived because we rather like the term, but it's the Health Application Network for Development and Innovation. What it's about, it's a not-for-profit organisation, a community interest company, which we've set up a group of clinicians and developers to support and promote the use of apps in the health and care environment.
So you mean on mobile phones?
No, I mean on a whole range of devices. I think what excites us is not the fact that the app is mobile, but it's the new development paradigm that comes from that world of mobile, but we now see it moving outward onto other devices.
Right.
So an app might run on a mobile phone or a tablet or a digital television or a traditional desktop or laptop PC. What's important about the app paradigm is that it provides a way of developing and deploying software which is order of magnitude quicker and cheaper than traditional development methodologies. And we thus think that this approach has tremendous potential to deliver software that can provide the sort of transformational change of health and care that we've been struggling to deliver for the last, well, me personally, the last 30 years, in an environment where the amount of funding available to support it is actually relatively limited.
But this is not sort of seen as some sort of magic white knight or silver bullet.
It is by some, but I think there are no white knights and there are no silver bullets. This is a new technology that we could be in danger of overhyping, but it does have tremendous potential. One of its key potentials is it actually allows frontline clinicians and other frontline workers in healthcare to engage effectively. And that's particularly true in the acute sector. And it reminds me very much of the early days of primary care computing. And primary care computing has been a success, not least because enthusiastic young GPs met people, when in those days, enthusiastic young developers like myself, got together, understood each other's domains and started doing something useful. Junior hospital doctors have felt disenfranchised. The chance of an F1 in a hospital being able to influence the way their Cerner deployment goes is close to zero. But they are finding that they can build a useful app which is actually helpful in the clinic that they're working in and that their colleagues value. And it's sort of harnessing that enthusiasm and energy and putting some support around that. Because often these people, they're ignorant of the whole world of health informatics. They're perhaps not very sophisticated in terms of, business models to support what they're trying to do. So we're looking at trying to help and support that community to deliver a new range of software.
And we touched earlier on, before we came on camera, on some of the types of practical issues that people are sort of beginning to share within the still very new HANDI network.
Yeah, that's right. I mean, the idea for this arose from somebody who was actually working on an app and finding that there were many things that she was having to do which she felt probably had been done elsewhere before, if only she could find out who'd done it and pick their brains. Some of those things are generic things that you need to do if you're developing an app. But the things that were particularly of interest to us were those things that are peculiar to the healthcare environment. So issues of clinical safety and product liability in the health environment, information governance, which is always a major issue in any sort of healthcare IT development, healthcare interoperability. Many apps would like to be able to get data from existing systems or contribute the data they collect back to existing systems, but many of the developers would have no idea about how to do that, or indeed what things may already exist to facilitate that. So we're interested in, it's about facilitating collaboration, networking, learning, and people working together to help each other to really to maximise their return on investment. So whether they're looking for a commercial return or a social return, we want to help them maximise that investment for appropriate collaboration, but also for a competition.
Okay, so there's a website, first of all?
There's a temporary website currently there, www.handihealth.org. We're in the process of building a much richer web platform which will facilitate the sort of discourse and information sharing that we're talking about. So
then also events as well? And
yeah, we know that to get effective innovation, you actually need to bring people together face to face. So we're building 3 geographical clusters initially. One in around London with support from UCL partners and some of the commercial people at Tech Hub around the so-called Silicon Roundabout in East London. Another cluster around Warwick University's Institute for Digital Healthcare, and a third one with support from Newcastle University and Newcastle University Business School in the northeast, with more embryonic plans for somewhere in South Wales and somewhere in the central belt of Scotland. For the first 3 of those, we've got launch workshops coming up, one in London, one in Warwick University, and one in Newcastle, the first of which is in Newcastle on the 9th of May. And you can book places on those through the website.
We'll put the link up at the end of this.
Yeah.
Okay, and also I understand that that we're going to be learning more about sort of Handi's progress later on in the year at EHI Live.
Indeed.
Which would be great to have you there. And, well, wish you every success with Handi. Still at a very early stage, but I understand you've had a very good response already.
Yeah, I mean, we've had over 300 people register an interest.
Which is fantastic.
The bookings are only open for 2 of the workshops so far, but we're already sold 70% of the tickets for the Newcastle event, which is still the best part of a month away. So we're expecting to sell out for those 3 workshops and may run some more.
Well, we look forward to continuing reporting on the development of Handi, and we'll be putting up sort of the website address. Ewan, many thanks for telling us about Handi, and wish you every success.
Thank you, John.
Thanks.
Thanks.